So we're here today here in FemCare Health and Beauty in Burbank with Marina. Marina is here for her last ozone therapy. She started with us about 2 months ago?
Yeah, 2 months ago.
2 months ago.
Yeah, 3 months ago.
Tell us what made you decide to do this treatment, Marina?
When I came the first time here, I felt very bad. I think for the COVID,
Mm-hmm.
and then I feel a lot of things like anxiety, depressed, pain back, pain chest, and panic attack. A lot of things.
So she was having chest pain, back pain, anxiety, shortness of breath, chest tightness. So these are symptoms that she manifested and felt ongoing after COVID back in December, right?
Yeah.
December, okay. And so she went to cardiologist.
Cardiologist.
They did a whole cardiac workup because of her chest tightness and shortness of breath. EKG, blood work, everything. They said it was normal and that was expected after COVID. And what did they do for you? Did they treat it? Did they give you medication? Anything happened after?
Absolutely nothing.
Absolutely nothing. Okay. So then she came to us. By then she had already started her first session. So right now I'm putting in an IV. Okay. So we have to have IV access. We're going to take 60 milliliters of blood. And so again, she came in and she was having all these symptoms. We did one session. What happened after your first session? Kind of, you felt okay?
And the second and third time in, I began to feel good.
You started feeling better after the second?
Mm-hmm.
Okay. So the chest pain went away after the second. And then the shortness of breath.
Mm-hmm.
Energy, how's your energy? Feeling more?
After 1 week, I feel a lot of energy.
Good. Okay, so now we're taking the blood. So what I did was added a little bit of heparin because we want to make sure that the blood doesn't clot, because as soon as it leaves the body, it's at risk for blood clotting, but the heparin helps us so it doesn't clot. So one thing I want you guys to pay attention is the color of her blood. When we mix it with ozone, it turns into a very pretty red, like full of oxygen. So ozone bonds with albumin in the red blood cells in the blood and immediately oxygenates her blood. So when we give it back to her, it's full of oxygen. And that's why one of the main reasons she was feeling better. The other thing that we have been doing after we add ozone, we also run past the blood through a very powerful ultraviolet light. And for those people that paid attention to the news when our previous president said, hey, it would be good to look into, heat, ultraviolet light, and I think he said disinfectant. Well, guess what? Ozone is 1,000 times stronger than chlorine. So it is a disinfectant. It's a natural disinfectant for the human body. It kills bacteria, viruses, mold. A lot of people have mold toxicity and they don't even know it, and they go to their doctors and they tell them, hey, you just have allergies, take some Claritin. All that sneezing, all those rashes on their skin, oh, that's just eczema or psoriasis. And those are all health issues that can improve with ozone therapy, because the underlying cause could be, again, mold, fungus, yeast, all these things, because we are exposed to it. It's in the air, it's in our environment, it's in behind our walls if we don't know. believe it or not, it could also be in your laundry. You know, when you do your washer machines. You know, these can all have that. I'm gonna grab some ozone. Okay. So this is our ozone generator. So we have our oxygen tank. We're pulling oxygen. Ozone. So ozone is 3 molecules of oxygen. So we have our 2 molecules here that go through this device, and this adds the third one. If you can see, here's our ozone. It's very dense, so if we keep the vial up, it will not leave. It's actually still in there, believe it or not. It's transparent, you can't see it. Okay. So look at the dark blood. I'm going to do this over here so we don't make a mess. Okay. Okay. Making sure everything flows. So we're absorbing all the ozone in here. Then here is our cuvette. I'm going to prime it. Once we prime it, you already see how nice and oxygenated that blood looks. So here is our cuvette. Prime the blood. So the other thing I want you guys to know is that we're very comprehensive. So not only did we address the shortness of breath, the chest pain, the fatigue, but we also drew blood for Marina in the beginning of her therapy, and we also did notice that her hormones were off. So we ended up also doing bioidentical hormone replacement therapy for her. So we also optimized her hormones, and that was what really helped with her depression. You know, I believe she was going through a breakup. Mm-hmm. So here, let's turn it on. That's our ultraviolet light, and this cuvette attaches here, and then our blood is going to slow into that strong ultraviolet light. And I'm going to grab a tape and secure it so we don't lose it. So there's so many ways that we can do ozone therapy. We can do ozone through the ears, like as ear insufflation. We can do ozone through the vagina. We can do it through the rectum. We can do it intravenous. At Rejuvenate, we also have a sauna. We can do ozone therapy as a sauna. The best way to do ozone is IV. Let me actually clear a little bit of the bubbles that we have here in the IV. Making sure she's not getting any bubbles. See the redness? How dark compared to, I think that's pretty cool. When I did the ozone therapy, I did 2 sessions, and after my second session, definitely I had no alcohol cravings. So it helps detox the body, oxygenates the body. What else?
I had diabetes. I told to my doctor. I was taking medicine before, but no more medicine for now.
This is the first time you told me that.
Yeah.
Nice.
Yeah.
Congratulations, you 5. So she said she had diabetes and she was taking medication, and she went to see her doctor after how many sessions? Did you take?
5.
After her 5th session?
Yeah.
Wow. Again, but we did a combination treatment. So remember, we were doing the vitamins, which, do we still have vitamins?
Mm-hmm.
Yeah. So I'll get a vitamin drip for her ready. We were doing the hormone pellets. So we optimized her hormones. We nourished her body with nutrients, and we oxygenated her body with ozone. So once you start, this treatment, she, after her 5th session, she was told she did not need to take any more medication. That's amazing.
Mm-hmm.
Wow.
Yeah.
I'm so happy for you. Okay, great.
I feel great. I feel great now.
Awesome. Okay, so to wrap it up, just letting you guys know, we did a second pass. So this is the second blood draw we took. So we did first, pass. After that was complete, we drew some more blood, and we did a second pass. Again, we're passing it through the ultraviolet light, so she's getting a very, very good treatment. After she's done with ozone, we're also going to nourish Marina with some vitamins to help her feel amazing. She's going to want to go, and she actually just told me she's going back to the gym, so with the ozone and the vitamins and her pellets, because she also, like I discussed, we had done pellet therapy. She's feeling great, and I mean, you could tell she's not the same person I met a couple months ago. She actually looks alive. she looks happy. She looks motivated, and you could tell when a woman, feels great. She definitely looks great. It's not only external, but I feel she's internally feeling amazing. So I'm very happy and privileged to be part of this process and to have made a positive change.
Thank you.
Yeah, so happy for you.
Thank you for having me.
Yep. Okay, that's it.
Great.